Jury in the case now hearing to be the truth, the whole truth, and nothing but the truth, so help you God.
May I?
Yes, please.
Thank you, Your Honor. Sir, could you please introduce yourself to the jury?
Hello, my name is Daniel Whitley, W-H-I-T-L-E-Y. I'm a paramedic with the Canton Fire Department. I've been a paramedic and firefighter there since March of 2006.
Before you became a paramedic firefighter with the Canton Fire Department, did you work anywhere else related to that field?
Yes, I had 4 years full-time as a EMT intermediate, and also a paramedic at American Medical Response in Brockton.
I'd like to take us right to January 29, 2022.
Yes.
Do you remember that day?
Yes.
Were you working?
Yes.
What was your role that day?
I was a field training officer working on the ambulance with my partner, Jason Becker.
Mr. Becker?
Correct.
That morning, did you know whether there was a call where a group of your colleagues went to address 34 Fairview?
Yes.
Were you accompanying your colleagues on that initial call?
No.
Where were you at the time your colleagues left to go to that location?
I was at the Station 2, Ponkabog Station, on the north side of town.
Different station?
Correct.
At some point after that call came in and was responded to you, did you receive a call?
Sometime after, I'm not quite sure exactly how soon or later it was, but we received another call to respond to that scene.
And as a result of receiving that call, did you make your way towards that location?
Yes.
Who did you go there with?
Just me and my partner at that time was Jason Becker.
What type of vehicle did you use to get there?
It was an ambulance.
What was the weather like?
It was snowing pretty heavily at that point.
Do you know about how long it took you to get to 34 Fairview?
Not exactly, but definitely longer than usual. It should have been an 8-minute drive. I'm guessing 10 to 12 minutes. You could refer to my partner's report for exacts.
When you got there, what did you see?
We arrived on scene. Our engine was there before. We run on a response with an engine and an ambulance to medical calls. And then at least 2 police cruisers and another car parked on the street, a gray SUV.
When you got there, did you meet with anybody?
Yeah. Usually we get out, we say hi to my lieutenant and the other gentleman, Sam Parker, was on the engine before we got there. They were up front of where we parked, and then we walked down further, or at least I did, to the gray SUV.
When you reached the gray SUV, did you see anybody inside it?
I believe at that point we were kind of, getting out. We were walking down, they were coming out to greet us. There were 3 women there.
Okay. Did you speak to any of them in particular?
Not at that point, no, not really.
At some point, did you have any interaction with any of the women?
Yes.
In fact, did you know any of the women who were there that morning?
I knew Kerry Roberts.
How did you know Kerry Roberts?
First we're neighbors. She lives about 100, 200 yards away from me, around the corner. And she helped organize a neighborhood block party, and I would volunteer every year to bring the fire truck to the block party and show the kids the fire truck for a little bit.
So you knew her well?
No.
Were you friends with her?
No.
Friendly?
I just would describe us as acquaintances.
Did you ever socialize with her personally, other than the block party?
No.
But you knew who she was?
I knew who she was. I don't recognize her, yes.
Did you talk to her that morning?
Not beyond probably a hey or hi or something like that.
Okay. Do you know whether she ever gave you any items?
I know at one point I had to exchange whether it was a purse or a cell phone or some object from Miss Reed.
At some point that morning, did you have an opportunity to meet with the defendant?
Yes.
Where did you first see her?
We were in the process of getting her to go to the hospital.
When you say we, who was helping you?
That would be, my partner, obviously, Jason Becker, and then my lieutenant, Greg Woodbury.
Where was she when you first saw her?
Somewhere outside in the street.
Do you recognize her in the courtroom today?
I do.
And could you identify her, please?
Yes.
Please. You're pointing to a person. Can you give just a very limited?
The woman sitting in between these two gentlemen here.
Did you interact with her that morning? Have a conversation?
Yes.
When you first started speaking to her, what was her demeanor?
Pretty upset, crying. She was. We had a Section 12 in hand, which is a medical order or a police order to be taken to the hospital for a psychological evaluation.
Did you discuss that with her?
Yes. Yeah.
Did you ask her to follow you or come with you?
Yeah, she did.
And did that happen?
To the ambulance, correct.
So you went to the ambulance with the defendant?
Yeah.
And was Mr. Becker with you?
Yes.
What happens when you get to the ambulance?
I mean, so it was snowing, and it was more to kind of just get everybody into a nice, warmer location where it wasn't snowing or windy or anything like that. And we would discussing that, we have a Section 12 that states we have, regardless of if you want to go, we have to take you to the hospital. She was arguing that she really didn't need to go to the hospital, and we were trying to convince her to go to the hospital because once the Section 12 is written, it doesn't matter what the patient says, we have to get them there one way or the other, whether it's cooperatively restrained or chemically restrained with sedatives or anything.
It's not a voluntary order?
It is not a voluntary order.
Inevitably, did the defendant agree to go with you to the hospital?
Yes.
When you were going to return to the hospital, was the defendant placed in the back of the ambulance where a patient would be?
Correct. So how we operate for anybody that's a Section 12 or anybody that is under the influence of anything, we always operate with two people in the back of the ambulance. So myself and my partner, Jason Becker, were back there. And then we had to take somebody from the engine company and have them drive to the hospital, and that was Sam Bach.
Sam Bach?
Bach, P-O-C-H.
Thank you. Before you left, before you started to drive away from Fairview, were you having any conversations with the defendant?
Yes.
Can you share with the jury what those conversations were about?
So we were talking. She was upset. She kept asking if there was any chance her husband could be alive, and even sitting outside in the snow with no coat on for many hours.
Did she indicate what many hours meant? How many?
No.
How often did she raise the issue of whether or not, or how long he could be out for?
I'd say at least 3 to 4, maybe more.
Part of your job is to care for patients?
Correct. Yes.
Was part of your job to try to get them to the location safely?
Yes.
And sometimes you treat patients with physical injuries, don't you?
Oftentimes it is physical injuries, yes.
Are you trained when you're trying to transport somebody on how to interact with them?
Yes. Well, sometimes if they're upset, in this instance she kept asking if there was any chance that he could be alive, and that we really didn't know what was the patient that ambulance 1 took. We really didn't know what his condition was, and but figuring that it was a hypothermia type case, being the conditions outside, we were trying to give her hope that there is a saying in the medical field, you're not dead until you're warm and dead. And I was basically, there's stories of children falling through ice and falling into rivers and being underwater for multiple hours and coming out, being resuscitated and having no neurological deficits. So I was telling her those stories just kind of to say, look, let's be sure we'll get to the hospital, we'll find out more there. Just trying to give her any sort of hope that her husband would be alive.
Can you describe her demeanor when she was in the back of the ambulance with you during your interactions with her?
She would go from pretty upset, crying. One instance where she kept saying, I can't take care of these kids, I can't take care of these kids, they're not my kids, and they're not his kids. And at that point I understood who ambulance 1 had taken, because John was pretty well known in the town for taking on the care of his niece and nephew. So I said, listen, it's okay. It looks like you have a very strong support system. And then Miss Reed said, do you know Carrie Roberts? And she had been crying, and she picked her head up and said, do you know Carrie Roberts? And I said, as a matter of fact, I do. And she said, anybody who knows Carrie Roberts wouldn't say that about her. And I said, well, she did come to out at early in the morning to look for your husband in a blizzard. And she just rolled her eyes and put her head back down. And I thought it was just bizarre.
Objection, move to strike.
I'll strike that last sentence.
Would you describe her demeanor as even through that ride?
No.
How long did it take to get to the hospital?
I mean, you can refer to my partner's ambulance trip report. I'm sure it has the
Do you have it right with you, sir?
I do not know.
Well, let me ask you.
I would guess about 15 to 20 minutes, somewhere in there.
You don't have an exact memory?
No.
When you get to the hospital with a patient under these circumstances, do you leave them at the door?
No.
What do you do?
We have to hand off care. So we go in and we have to give a report to a nurse to let them know what their condition is, why they're coming to the hospital, and what we found taking them to the hospital.
When you got to the hospital with Miss Reed, did you interact with the hospital personnel?
Yes.
Do you typically, after you hand off a patient to staff, do you leave?
Typically, yes. This time, Miss Reed was, I'm going to say, not really cooperative with the nurse there. The nurse was asking her to get into a Johnny, give a urine sample. She was not cooperative. The nurse tried to work with her, had an ER tech go and ask the doctor if she had to get into a Johnny. She came back. She said, yes, she's a patient. She has to do all the normal stuff. We really didn't feel comfortable actually leaving the general area. I don't know if it was just shift change or what, but security wasn't there. And with her demeanor, we just didn't feel comfortable leaving the nurse by herself with Miss Reed.
You said that there was some difficult times. Was there some difficulty about the defendant accepting wearing a Johnny?
Yes, she was refusing to get into the Johnny, and the nurse kept saying, well, you got to get into this Johnny. The nurse did try to work with her and asked the doc if...
Objection.
I'll allow that.
And so the ER tech had to come back and say, yes, she has to get into the Johnny. And at that point, she did. She seemed to have calmed down and was getting into the Johnny. Security personnel had shown up, and we felt comfortable being able to kind of leave the nurse and the tech on their own.
Before security came, was there difficulty in her providing a urine sample?
Objection.
Do you know the answer to that?
Can you ask the question again? I'm sorry.
Why don't you ask it a little differently?
Sure. Do you remember whether she was giving the nurses a hard time about a urine sample?
Yes.
Objection.
So break that down, Mr. Brennan. The objection is sustained.
You said that she was giving nurses a hard time.
She didn't want to give a urine sample. And then the nurses kept asking her to, this is the cup, you pee in the cup.
Objection. Last one.
No, I'm going to allow it.
You were there and saw this, right?
I saw her, yes.
Thank you. No further questions.